Shitsuation. Let's level set something right up front. For most people, surgery is a medical event. For those of us in the bendy, floppy, mast celly, dysautonomic, pain management nightmare corner of humanity, it's a shitsuation. And yes, that is absolutely the correct spelling. A shitsuation is what happens when you take a normal medical situation and add the connective tissue of overcooked linguine, the mast cells of an emotionally unstable Pomeranian, the blood volume of a dehydrated cactus, and the anesthesia tolerance of a Viking who's been roofied before. Voila, a shitsuation. Now a new scoping review medical study on hEDS and surgical outcomes agrees with me. A scoping review is when researchers collect and give a summary of all the other research out there on the topic. Bottom line, they said it too. There is limited knowledge amongst healthcare professionals regarding hypermobility spectrum disorders, HSD, and hypermobile Ehlers-Danlos syndrome, hEDS, their multisystemic symptom presentations, and how to effectively manage them. Our review found that most studies reporting surgical interventions had evidence deriving from small sample sizes and a lack of long-term follow-up, limiting definitive clinical conclusions. We further highlighted a gap in the qualitative research that adequately captures HSD/HEDS patient experiences of surgery. Further robust, long-term studies are needed to properly inform surgical management and improve patient outcomes. Source: Clark, N.L., Johnson, M., Adamson, J. et al. Outcomes and experiences of patients with hypermobile Ehlers-Danlos syndrome and hypermobility spectrum disorders undergoing surgical interventions. A scoping review. The shitsuation begins before you even get to the OR. People think the surgical stress is about the procedure. Bless their collagen-rich hearts. But for zebras, the trouble starts long before anyone hands you a tiny hospital gown engineered by Satan himself. First, there's anesthesia. Normal humans. I counted to 3 and woke up. Zebras. I counted to 27, recited my childhood address, tried to negotiate with the anesthesiologist mid-intubation, and still woke up like someone unplugged me from the matrix and then plugged me back in wrong. Yes, I'm awake and I feel that. There's something uniquely humbling about telling a medical professional, listen, I metabolize meds like a faulty disposal unit. Whatever you think is enough, triple it, possibly in a slow drip, and warn the PACU. And then there's the pre-op conversation where we have to hand over the index card of doom. Yes, I'm allergic to that. Yes, I'm also allergic to the alternative. Yes, I react to the thing you use to counteract the allergic reaction. No, I don't know why. Yes, I'm also scared. And they write it all down like they're drafting a character sheet for a D&D campaign. Class, medical anomaly, weakness, adhesives, opioids, gravity. Special move, spontaneous hives. The actual surgery, a choose-your-own misadventure. Here's where things get chef's kiss interesting. Will the anesthesia work? Will it work too well? Will the intubation become a spontaneous chiropractic adjustment of your C-spine? Will your mast cells stage a coup? Will your blood pressure plummet like a badly performing crypto coin? It's like a carnival game but with higher stakes and no stuffed animals as a prize. Sure, the surgeon is doing their thing, but meanwhile, your body is backstage like, plot twist, we're not doing any of this the normal way. Read my actual serious medically vetted EDS surgery prep guide published previously on the Chronic Pain Partners nonprofit website. Post-op. Welcome to the Wound Healing Olympics. We don't medal here. You know how normal people get stitches, heal in 2 weeks, and then go live their lives? Cute. Jelly. Meanwhile, we're over here doing scar roulette, incision Jenga, suture surprise with keloids, and Olympic-level inflammation. Connective tissue disorders plus healing equals a comedic tragedy in 3 acts. Act 1. It looks okay. Act 2. Why is it doing that? Act 3. Should I call someone or just give up and join a monastery? And of course, the follow-up appointments where you have to explain to yet another provider that no, it's not infected, that's just what my collagen does. Don't take it personally. Pain management, the punchline. That punches back. Trying to get pain relief when you metabolize opioids like a wood chipper is a special kind of fun. On a scale of 1 to 10, how is your pain? Sentient. And then they give you Tylenol, because of course they do. And then there's the emotional shitsuation. Let's not skim past the mental and emotional part, because this is the part no one sees. For any human, but for us, it's identity shaking. It's a referendum on your body, a reminder that you can prepare perfectly, communicate flawlessly, advocate fearlessly, and your body may still go off script. It's not just a shitsuation, it's a soul situation. Why do we keep going through surgeries? If they're such shit situations, because sometimes, even when your body is dramatic, complicated, and prone to side quests, you still deserve relief. You deserve functionality and stability. You deserve hope. And sometimes surgery, with all its unpredictability, is the only available path. We don't choose it because it's easy. We choose it because we're trying to stay alive in these bendy, malfunctioning, mast cell-riddled meat suits and want a fighting chance to live well. The silver lining: zebra resilience is real. EDS. People don't do anything the simple way, but we do everything the determined way. We know our bodies better than most clinicians. We've survived medical trauma that would crumble the average person. We've built communities, knowledge bases, and coping strategies out of sheer necessity. If surgery is a shit situation, we are the experts in serving it up it. For reals. If you want more serious and not so sassy medical advice on how to prepare for surgery when you have EDS, read Dr. Linda Bluestein's post on questions to ask your surgeon. Subscribe to her Substack, Bendy Bulletin. Check out this physician's guide on how to locate the right provider in every specialty. The last crap. Even when your body misbehaves, malfunctions, or makes recovery look like a cartoon tornado, you are still brave. You are still worthy. You are still here. And that, in true Zebra's Underground fashion, deserves its own article someday titled, "Why My Body is a Dumpster Fire, and Yet I'm Still the Main Character." Stay safe in the underground, and subscribe already. This stuff doesn't write itself. Join me at Zebra's Underground on Substack.